First and foremost, it's really nice to see everyone in person. This group, so many of you are responsible for where we are today. My name's Laura Dragowski. I'm the manager of the Office of Community Health and Safety, created last year by Mayor Peduto and Director Hisrick, our public safety director. Thank you for being here. I'm really excited and frankly very humbled to see the opening of the first of 3, and hopefully more in the future, community outreach hubs. These were established by Allegheny Health Network's Urban Health and Street Medicine program in partnership with the City of Pittsburgh. This is what we know is the beginning of a long commitment and partnership by the City of Pittsburgh and Allegheny Health Network to expanding access to the continuum of supportive services for people in our community with unmet needs and ensuring that we are focused on public health and public safety. While our community members and our first responders, including many of whom are behind me today, have long recognized the need for expanded access to social services, this has felt outside the purview of our municipal government. The recognition of what we call the right responder, a first responder who is part of an expanded continuum of public safety response, doesn't start just with the inception of this program. This program and this work are the culmination of the voices of our neighbors, our first responders, and our direct service providers. I want to honor that work they do every day and acknowledge that this exists because of them. So how did the program start? I like telling these stories that kind of get mythologized, and this one doesn't really need a lot of help. During a 1-year period between 2019 and 2020, January 19, January 2020, the county's yearly census of people experiencing homelessness increased from 2 people to 50 people in Homewood, just in Homewood. The city has 90 neighborhoods. That's one neighborhood. The county has 130 municipalities. Did one neighborhood have a significant increase in homelessness in 1 year? This had never happened before. The answer is no. The problem was that without data and without proof, these people didn't exist. The problem was that for years, volunteers had cursorily driven her through neighborhoods across the county and in some cases made rough estimates of unsheltered people in our region. Dan Palka, who you will hear from shortly, and his team knew this was wrong. They identified these community members because they knew that these were people who had been forgotten. They saw them in the street, but never in the shelter, and certainly never in housing programs. In 2020, their approach was to walk the neighborhood, work with community members, meet people where they were, and commit to continuing to support them. Dan brought this information to Chief Gilman, Mayor Peduto, Director of Public Safety Wendell Hisrick. For nearly a century, the city's municipal government focused on zoning, environmental services, emergency medical response, and other very, very critical needs in the city. But this was unconscionable to all of us, that nothing was being done, however, not to the surprise of many people who lived in those neighborhoods every day. At issue is that the experience of homelessness looks different, not just in every neighborhood, but for every person. Couch surfing, living in abandoned buildings, sleeping in your car, residing in a family home that's no longer safe. It's not just limited to people living in tents and people living under bridges. Some people were criminalized and some were cared for, depending on how they presented. The disparities ultimately had deeply racial implications as well, and the city had not had agency over these processes. Dan and the AHN team proposed a novel partnership that Allegheny Health Network and the City of Pittsburgh coordinate to address health and safety inequities, prevent criminalization of people who are unsheltered in our city neighborhoods through proactive outreach, public safety co-response, and continued care for those who are most often stigmatized. In short, the program sought to obliterate the arbitrary definitions of what homelessness is. Our collective focus is jurisdictional equity, that people should not have to come to the service, but that the service should come to them, and that people are not judged by where or how they live. The network of hubs, staffed by expert people working collaboratively with public safety and the community to provide safe spaces for people with unmet needs, will allow people to get what they need, when they need it, in their communities. This commitment represents the future of caring for communities by being in communities, and it wouldn't be possible without a multitude of partners. I want to take a moment to thank our ESG team, Whitney and Kelly, the URA, Director Flisserum, David Geiger, the Parking Authority, Director Honorado, one of the two honorados who are part of this process. The Pittsburgh Downtown Partnership, I see Colton and James, and a deep thanks to Jeremy Waldrop. The Public Safety Department, in particular, Wendell Hisrick, Deputy Director Shatara Murphy, Assistant Director Lee Schmidt, Commander of Zone 2 Matt Lackner, Commander of Zone 5 Steve Vanansky, and Sergeant Colleen Bristow. I'd like to thank Reverend Burgess and Councilmember Lavelle for their continued funding of Stop the Violence and their reinvestment in the community. I'd like to thank Chief of Staff Dan Gilman and Mayor Peduto for their continued leadership in this space. I'd like to thank my colleagues from the Office of Community Health and Safety, who are always laser focused on promoting equity. And most importantly, Dan Palka and the AHN team members, Zones 1, 2, 5, who do this work daily and have developed the vision, maintained operations, forged relationship to do what no one in the city has done before, quietly and excellently. It is now my privilege to introduce Dan Palka, the Director of Urban Health and Street Medicine at AHN and the founder of this program.
Thank you, Laura, Mayor Peduto, Public Safety Leadership, Highmark, AHN, our leadership team at the Center for Inclusion Health, Stuart Fisk, Margaret Palumbo, Liz Cuevas, and Pat Perry, and our community partners, PNC, Pittsburgh Downtown Partnership, DLA Plus Architects, and Highwood Properties for celebrating the opening of our Community Outreach Hub today. Of the myriad healthcare facilities that our city and region can boast of, this one is unique. And for all the reasons that it's unique, perhaps the most important is that it is rooted in the deep history of our city, one rich with innovation and pragmatism in the field of community safety. It's no exaggeration to say that Pittsburgh has set the standard by which the rest of the world has come to understand community care. When the Walking Sisters of Mercy first began their work in the US 180 years ago, they piloted their methods attending to the poor and sick residents of Pittsburgh, establishing a tradition of meeting people where they are. Ever afterwards, the practice became the standard for those seeking to connect with people left unserved by conventional models of care. In 1967, Freedom House Ambulance Service was founded by local emergency medicine physicians and community members from Pittsburgh's Hill District neighborhood deemed the unemployables. They had witnessed neighbors suffering because of the seemingly limitless asks of police. Most critical health issues were being managed by law enforcement. So they founded the first professional ambulance service in the world. And in so doing, absolved law enforcement of managing cardiac arrests and overdoses and delivered an altogether unprecedented level of community care. The work continued. In 1992, Dr. Jim Withers first began bringing clinical care to those living on the streets of Pittsburgh, beginning the international street medicine movement, one predicated on bringing healthcare and advocacy to those on the streets who were otherwise stigmatized with rigid and inflexible healthcare systems. Our program is a continuation of this tradition, emphasizing several clear themes. Firstly, when proactive, we can ensure that our community members not only receive the care to which they are entitled as human beings, but also that they are aware of the care that it exists for them. Availability is not accessibility. Secondly, the community has deep wisdom and deep trauma. If you're willing to listen, both will tell you where to begin the work. Often providing personnel, resources, advocacy, and spaces to convene may be all that is needed to empower community to heal itself. Thirdly, reinventing systems from healthcare to the criminal legal requires engagement and dialogue. The community members whom we love so much will only begin to receive just care when their neighbors can begin to be the ones providing it. These principles inform the work of our team, who are arrayed throughout this crowd here today. Nicole, Farouk, Tim, Ben, Matt, Marcus, Lucille, and Tony, they're all here somewhere. We've had the remarkable good fortune to find people who both care deeply about their neighbors and also are willing to do something about it. Without your tireless work, this entire program would be nothing more than a good plan. And the team will grow. Over the next year, we'll begin to add staff with a diversity of backgrounds for a variety of different roles, but this group was the group that took a chance on an idea and developed it into a shared vision. I hope you'll join me in thanking them for their work and the home that we're giving their work today. By decentralizing services and establishing a network of neighborhood hubs, we can help promote equitable access to services, including the new 2nd Avenue shelter. I know Alyssa and Nick are here today. And lastly, for the hubs, the shelter, the opportunity to do this work, and so much more, I would like to thank, on behalf of AHN and all of the people that we serve, Mayor Bill Peduto for establishing a legacy of community care in keeping with the rich tradition of our city of Pittsburgh. Thank you.
First off, I want to thank the team. You're the ones that get the job done. And without you and without the presence of what you give to the people of Pittsburgh, this doesn't happen.
Thank you.
To all that are involved and to the visionaries, I've been approached by mayors across the country that have asked not only how did we get this started, but what is the mission? How does it work? How is it that you create a partnership with a medical center in order to be able to provide with it something that is not really within the purview of local government? Health and Human Services are a state function that is provided on the local level by county government. And it's been over 100 years since the city of Pittsburgh has provided health services. But if you look at the needs of our community today, they are very different than what they were 20 years ago. And we cannot keep passing the ball off, because the needs in Bethel Park are very different than they are in Larimer. The needs of downtown Pittsburgh, where all of the services are provided, and where the community of those that are homeless, and those that are suffering with a disease called addiction, and those that struggle with mental health issues, are very much different than they are in Ben Avon. And we recognize that we have got to be able to provide services that are not breaking the law. For so many decades, the only way that we treated our neighbors who need help is through law enforcement. And the only place that we would send them for help was the Allegheny County Jail. And instead of providing them the help we need, we made their problems worse. And we recognized well before the defund the police movement that we needed to rethink policing and to reform and reimagine what policing meant. And yes, that meant to invest in policing, invest in what the services policing meant in the city of Pittsburgh, and not defunding police, but to allow additional resources and additional professionals to be there in working in mental health issues, social workers, those on the ground that can say to my brother or my sister that need help, let me help you to get your life back in order. Because what you are suffering from is not a part of the Pennsylvania Code of criminal activity. What you're suffering from is what our calling is when we talk about helping one another. And yes, with a new no barrier center that will be a 360 center that will be more than just housing and warehousing homeless people, but will be a 360 center that will be able to help people and their pets with all of the services that they need in order to get their lives back on track. And with this center, and 2 more to be built, and to be able to provide 24/7, 7 days a week, all year long, and with the federal assistance grants that we got, not only in 3 zones, but all 6 zones of this city, an expansion that will be built out starting this year and fully implemented by next year. We will not only be able to complement the work that is done by the county and the state, but we will be able to create a model for every other city around the country to be able to follow. So that when people ask and say, what is the role of cities in pursuing health and human services for those that need it most, people will be able to answer, ask Pittsburgh. As was said before, this is not new. Pittsburgh has been the leader for several decades in taking care of our own brothers and sisters. And during this past decade, we have watched as the East End Cooperative Ministry build out a state-of-the-art center out of the basement of East Liberty Presbyterian Church. We watched as in the north side, Light of Life Missions was able to build out a state-of-the-art center in the north side and broke ground on a second that will be able to work with families and women. We work proudly with St. Joseph as they were able to modernize and build out in the Hill District, and as the Y was able to build out and modernize their facility. We broke ground on a state-of-the-art in the uptown neighborhood in order to be able to pull together all of our institutional and corporate partners and understanding that homelessness is not getting better, it's getting worse, and the cross-section of homelessness with mental health needs and the needs of an opioid epidemic that is greater than the crack epidemic of the 90s and the cocaine epidemic in the 80s combined is affecting our brothers and sisters in Western Pennsylvania. And we have worked with others who are on the front line in order to be able to help them to expand their operations as well. But there is a part for city government that we can no longer say that's part of county government or state government. As we've watched since the 1980s, federal funds shrivel and go away because the voices of those that need the help are not heard in the halls of Congress. If we've watched as state mental health facilities and other facilities have closed their doors, we have watched as the needs of these individuals have come to our streets. It is now time for us to stand up and to be able to put the resources to be able to help them. And not to be able to say that is not our job, but to be able to put the resources and the money where it is needed, to be able to get their lives on track and to stop using penitentiaries as the place for them to be able to get help, and to put them in the places where they can really get that help, and to put the officials who have the training in order to be able to help them. This is the complementary effect to policing in the 21st century, where our officers can concentrate on the calls where people are breaking criminal code, and our workers on the streets can help our brothers and sisters who need that help. For everyone in this room that's been a part of creating the system, thank you. What you've created will be multiplied in city after city across this country, and it will work to help to bring together community and policing for decades to come.